All right.
This is Peter.
Hogan, seconded by Supervisor McDevitt. Any additions or corrections to the meeting minutes? All right, if not, we'll vote on it then. All those in favor?
Aye.
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 Opposed? Carried. Thank you. And with that, I will turn it over to Dee, and she can start with her agenda.
Good morning, everyone.
Good morning.
So the first item we have on our agenda is permission to submit our New York Connect grant application for the period of April 1st, 21 through March 31st, 22, in the amount of $203,636.
All right, would someone like to bring that motion to the floor? Supervisor Conover, seconded by Supervisor
I'll second it.
All right,
Peter, yeah.
McDevitt. All right, any questions on that particular resolution? All right, if not, then we'll vote on it. All those in favor? Aye.
Aye.
Opposed? All right, thank you. Carried. All right, D, number 2.
The next item is permission to fill a vacant position of meal site cook number 4, grade 2, base salary $27,438, 35 hours a week at our Cedars meal site. This is due to promotion. The individual in this position took the food service manager position. And with this, we'd also like to fill any positions that may be vacated due to filling this one.
All right, would someone like to bring that resolution to the floor? Supervisor Conover, seconded by
I'll second.
Supervisor Hogan. I just want to check one thing here, Dee. So this one is due to a promotion, but I was looking, am I mixed up with what I see on the back, or does that say resignation? Is that a different position on the sheet of intent to fill the vacant position, or is that different?
I just noticed that myself. That's an error, so that should be crossed off, and it should be promotion.
Okay, I thought maybe, but I wanted to check to be sure. All right, thank you.
Or resignation for the promotion.
Well, that's
True.
true. All right, so we've had a motion and a second. All right, we'll vote on it. All those in favor? Aye.
Aye.
Opposed? All right, carried. Thank you. All right, discussion items, Dee.
The next thing we have is we did develop, finally, an annual report for the Office for the Aging. So we just wanted to give you guys an idea of what we do here at the Office for the Aging, where our funding comes from, how much or how many units of service we provided for last year under each of the contractors, how many clients we served, and then how much we spent for each of the counties, and then also some information on the breakdown on the individual meal sites. So I gave this to you guys ahead of time so you could take a look at it and then ask me any questions that you might have on it instead of going through it page for page.
No, I appreciate that. Now, most of you then have had a chance to look it over. Do we have any questions for Dee from the committee? No questions? All right, that's good then. Thank you. And we appreciate this report, Dee.
Yes. I would like to stress, how much the meal site staff and the office staff did this past year. It was tremendous to see how everybody pitched in through the pandemic. While we couldn't do some of our normal services, everybody, they did what we could and what needed to be done. The meal sites were fantastic in, coming in every day and making sure that the seniors got that vital service, the home delivered meals. While we couldn't provide the services at the meal sites, anybody that needed the meals, we signed up, we delivered them to home. And you will see that, while some services we did not provide, the bulk of them, we still provided the same number of services that we did from 2019 and 2020. Our funding, we got, quite a bit of stimulus money, so we didn't have to use a large portion of the county monies that we typically do every year. And we did get a big, pretty much the same amount of stimulus monies that we'll be able to utilize for 2021 as well, which is great. But, overall, I want to compliment the Office for the Aging staff. both at the meal sites and here in the office for the tremendous job that they did last year and everything they did, and without complaint. They did a great service for our seniors.
Oh, and I thank you for making sure you recognize them for all that, because everyone did work extremely hard to make sure that everything came down the way it should. Thank you, Dee. Any committee members have any questions for Dee? Supervisor Hogan.
I did just want to say that I noticed on both the congregate meals and the home delivered meals, the numbers were not nearly as high as I thought for the amount of service and the quality of service that you guys provide. I'm really impressed with how much you do with how little. And thank you for your careful stewardship, both of federal and county monies, but also your great care for our seniors.
Thank you, Supervisor Hogan. That was a very nice comment that you made. All right, anyone else? I guess with that, then we're all set with Office of the Aging. Thank you very much, Dee, and we'll be in touch during the month.
Thank you.
All right, with that, I think we'll just move right into health services, public health, and then we'll ask for anybody that might have been on YouTube. So with that, Janelle, are you here?
I am. Good morning, everybody.
Good morning. So we will start with you with your agenda.
All right. So our first request for resolution is to amend our ELC COVID grant contract with New York State Department of Health and Health Research, Inc., to extend the termination date to March 31st of 2023 and to allow for any further extensions to be authorized without further need for board resolution. And the chair of the Board of Supervisors is authorized to sign any and all further extension agreements with New York State Department of Health. The original grant we had was from July 1st of 2020 to June 30th of 2022. This amendment is going to extend the grant to March 31st of 2023 and allow any further extensions to be authorized without new resolution.
Right? Would someone like to bring that resolution? Supervisor Conover, seconded by?
I'll second it, Edna.
All right. Sorry, Supervisor Hogan got ahead of you there, Peter. But thank you.
No problem. Thank you.
Any discussion on that? All right, then we'll vote on it. All those in favor? Aye. Opposed? Aye. Carried. Thank you. All right, Mel?
All right, I hope everybody's nice and alert this morning. Our request for resolution number 2 also involves ELC funding, but in a separate grant. This is to apply and accept New York State Department of Health / HRI ELC grant funding in the amount of $1,730,012 for the grant period of 7/1/2021 to 7/31 of 2022. Just to be crystal clear, this is a separate grant from the one that I just asked. And this ELC funding is being made available to counties to assist with schools with COVID-19 testing and screening to maintain in-person learning. The county had to submit a letter of interest, which we had to do prior to this meeting, which has been done. And in speaking with the treasurer, a budget code has not been set up yet until we know exactly what we're going to be doing with this money. But for now, we just wanted to get the authorization to apply for the grant.
I would like to make that motion so we could apply for the grant.
I'll make it.
Supervisor Hogan, seconded by Supervisor Conover. Any discussion?
I have a couple.
Yes, please go ahead, Supervisor Hogan.
Janelle, is there a match component to this? And the second part of my question is, do we have the systems in place to administer something on this scale?
The first answer is easy. No, there is not a match. It's a vouchering process. So whatever money we spend, we then are approved up to that amount to receive reimbursement for our expenses. The second part of your question's a little bit more tricky, which is why we don't have a budget code right now. The counties really were looking for something like BOCES to take this money, or state ed, because it is working directly with the schools. But my thought is there will probably be a testing contractor, and we're just going to be kind of a go through. where the schools are getting the services and we're paying for those services. We're working with BOCES to maybe try to do something regionally. We're working with neighboring counties, but it's still too early for us to know what this is going to look like. But the thought is whatever testing entity there is there, whether we have to create one or whether we go out, find one and pay for that, these funds will be utilized for that.
Thank you for those answers. All right, so shall we vote on that then? I think we had a first and a second. All right, all those in favor? Aye.
Aye.
Opposed? All right, carried. Thank you. Request resolution number 3.
All right, this is to request an extension of a notice of intent to fill for our full-time senior account clerk number 1 position with an annual salary of $33,600. This is attachment number 3. This position's been vacant since a retirement in January, and at this time we've been unable to hire, and we're using a per diem temporary senior account clerk, which has actually been working for the moment, but we need the authorization to fill.
Someone like to make that motion? Supervisor Conover, seconded by Supervisor Hogan. All right, any questions? Supervisor Conover.
Janelle, what do you sense is the proper salary?
Can you please repeat the question? I just turned my volume up.
Pull your mic in, sorry, Ron.
I'm sorry.
Thank you,
That's-
Supervisor.
The error's on my end. Are you having problems filling this? Do you know why?
Well, part of it is just with COVID. It's been a little bit of a back burner type situation that we really need to bring to the front of the burner. Working with personnel, I believe they're working on a list of candidates. The one list was getting ready to expire. I think a test is getting ready to come up. But I think more importantly too is we're trying to squeak by as long as we can because we're able to save a little bit of money by using a per diem person right now. As long as that per diem person's able to continue, we're trying to squeak through the end of the year to try to make a more final plan. The other thing is, as you know, we have a business specialist program that we're training for the jobs and roles, you know, to be able to work with this person and provide a little bit of backup for this person. So we're going to be using this person to help train as well. So we're in the process of training that person. And Ton's here if there's anything I forgot.
No, I think that's it. This position is a very, very important position within it's the position, I should say, pays pretty much all of our bills that we take on a daily basis. And working with contracts and working with purchase orders and journal entries. And so it is a very important position that we do need to extend. And if we need to fill it before the end of the year, before the end of the quarter, we will. And definitely plan on keeping it in the budget too.
All right, thank you. All right, then let's vote on that. All those in favor? Aye.
Aye.
Opposed? Thank you, carried. All right, resolution 4.
Okay, resolution number 4 is to renew and amend the contract with Strategic Healthcare Programs, LLC, to reflect an increase only in the annual fee portion of the contract, which is going to go from $8,195 to $8,440. That is a $245 increase, and to authorize future annual renewals as long as the contract expenses do not increase more than 5%. This contract, just so you know, also includes a quarterly bill for patient satisfaction surveys, for which there was no change from last year, and we're currently paying $195 per survey. Home Care has a contract with Strategic Healthcare Programs to facilitate patient satisfaction surveys, which are required as a condition of participation. This resolution authorizes our $245 increase in the annual fee and also an automatic annual renewal of the contract for July 1st, 2021 to July 30th of 2022 and subsequent renewals unless there's over a 5% price increase in the contract components or a 30-day written termination notice rendered by either party.
All right, let's bring the motion to the floor, please. Supervisor Conover, seconded by Supervisor Hogan. Any questions on that particular resolution? Mr. Conover?
Yeah, it's not a lot of money, but still, what are you using as a metric so that the contractor doesn't just assume that they can apply a 5%? Do you have some quantification that you use, some type of metric?
Well, every year we have to renew, and they give us their terms. We usually try to, there hasn't been an increase in a couple years, to my knowledge, correct,
I don't
Todd?
believe so. Yeah.
So this is the first time in a couple years that there's been an increase. I could get that exact number for you and when we last increased it, if you need to know that. But for the most part, when it's time for renewal, they give us the terms, and then we have to decide whether we're going to go forward or kind of challenge the increase or clarify why it's being increased. I think with COVID, this is the reason why this one's being increased at this time.
So there's an internal evaluation. That's my question.
Yeah, this is actually our office, our senior account clerk position. Even though she's still with us per diem, she retired and came back and worked with us per diem. She's the one that works with our vendors, and she has been working with them and came to the agreement that it seemed fair.
Thank you.
All right, thank you. Question, Supervisor Hogan?
Thank you. Am I reading this correctly? It looks like they haven't raised their fees since at least 2015.
I have to check on that. I'm not sure.
This is attachment.
Work includes a contract from 2015 to 8,195.
That's probably correct. I don't think SHP's come up in a while because of this.
Good on that. Any other questions?
Yeah, it says 193 or 215.
That's
Right.
correct, Supervisor Hogan.
Thank you, Janelle. All right, all those in favor?
Aye.
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 Opposed? Carried. Thank you.
All right, I'm going to turn the floor over to Ton to discuss resolution requests 5 and 6, and our first 2 or 3 attachments.
Attachment number 5 is just a budget amendment for what Janelle spoke about. The first thing it's regarding resolution number 1, that we're getting an extra $50,000. And so what I've done primarily is put that in salaries because it is for our contact tracers and fringe related to that. And I did put a little bit into telephone expense because if they need to use a phone, if they're out or have to deliver or something, we need to have some expenses there. So that's the $50,000 in attachment number 5 to amend that budget and that code of 4193.
All right, thank you. Would someone like to bring that motion to the floor? Supervisor Conover, seconded by Supervisor Stroud. Any discussion? All right, and we'll vote on that. All those in favor?
Aye.
Opposed? Carried. Thank you.
Attachment number 6 is just budget transfers, basically. The first one is our ER coordinator, who we spoke about last month, a position that she retired, a part-time one, and we now made a part-time one into a full-time. So we deleted 2 part-time positions and created a full-time. So number 1, I'm just asking to move $27,714 from our part-time line up to our full-time line to pay for that change. I didn't have to touch fringe because it's the same amount that's already been budgeted based on the salaries.
All right, thank you. Would someone like,
Oh,
Okay.
sorry. Did you want me to do number 2 also?
yes, go ahead.
Okay, just to let you know, number 2 is also our nurse that is helping in our disease program. She's budgeted within our family health department. And because right now we're not really seeing any children in COVID, she's been helping out in the disease program. And I did this the first quarter, so I'm just moving again another $20,000 in salary and fringe related to that into the disease program from the family health.
All right, thank you for that explanation. All right, someone would like to bring that motion to the floor? Supervisor Conover, seconded by Supervisor Stroud. Any discussion on that resolution? Mr. McGowan?
Thank you, Chairman. Tom, I want to thank you. That's really an interesting way of utilizing what we have coming through this pandemic and using our employees and shifting them around. And that was a nice use of the employee and the salary. So I thought that was interesting how you explained that. I just wanted to thank you.
You're welcome.
All right, let's vote on that then. All those in favor?
Aye.
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 Opposed? Carried. Thank you.
And attachment number 7 are our financials, which were as of June 8th. To give you an idea of where we stood as of that time, I will note that down again with salaries, we're under last year with 35.53 based on the budget. But at this point, a lot of our, obviously where we're over in salaries is our part-time and our overtime, primarily in our part-time, because that's where all our contact tracers and everything during COVID, which continued into this year. We are under in regular salaries because, as you know, like the senior account clerk and also nursing positions right now that we're trying to recruit and get those filled. And so that's why you see regular salaries that are under budget. And then attachment number 8 is the comparison of last year to this year. And again, just to bring to your attention again, the contract salaries expenses, again, are usually due to our preschool. Right now, that's a large chunk of the invoices, just a matter of being about a month behind or so. So they'll catch up with each other. And I also wanted to note that the revenues, while they reflect up to March in last year and they reflect up to April of this year. So that's where you're seeing, or reflects, yes. Therefore, I also wanted to mention about the referrals that we were saying, which, well, we go on to the next page, but we had less referrals. So overall revenues are down because again, in February or so is when they stopped again with some surgeries and everything because of COVID picking up. And then they started picking back up in April. We started seeing some more going on there. No clinics have been held. Even to this day, we are expecting to do a few rabies ones over the summer. But again, in our family health program, like we said, they're not seeing children. So in that respect, on those revenues, we're not seeing those.
All right, thank you. Any committee member have a question for Tom? All right, then I guess we're in good shape. We'll move along then. Thank you very much.
Then attachment 9A and 9B, again, are the referral numbers. And it will give you an idea, just you can compare April to last year and April to this year, and you will see that numbers have gone up. Again, that is again with as referrals come back in, as operations come back in, we start to see that a little bit more so in April, more when we get into May and June, we'll start to definitely see that increase. So 9A is just comparing last year, and 9B is showing you by towns we were able to print, so you can kind of see where a majority of the area is, as you know, usually down in this area, the Queensbury, Glens Falls area, but you do see those smaller towns and cities that have, at least we're touching a lot of different places. And that's all I have.
Thank you.
So attachment number 10 is our emergency preparedness activity sheet. That kind of gives you some of the activities that we've done throughout this month. So if there's questions with that, you can let us know. One of the things interesting to note, I mean, all the activities put here, you know, are certainly important, but I just wanted to highlight that we've been working with our skilled nursing facilities, and I actually got invited to go and speak. They have to get tested weekly, and for the people that weren't vaccinated, I had the opportunity to just try to talk to them, see if they had questions or concerns that were preventing them from being vaccinated, just to try to help make sure they're making an informed decision. At the end, the choice is ultimately theirs, but the administrator thought by having me available to talk to when they came in to test, that might help some of them change their mind if there were some easy questions that we could clear up for them. So that went very well. Also, moving along to attachment number 11, this is our rabies report for our rabies program. We've been keeping up on our bites and post exposures and submitting rabies specimens this month. I do want to say that we are definitely going to have a rabies clinic in July. It's going to be probably the second weekend of July. So be looking for that, but we'll get that out as soon as we have that finalized. We were going to try to do one the end of this month, and we forgot it was graduation. And then the first weekend of July is obviously July 4th. So we figured aiming for the second weekend in July would give us more time to advertise it. In addition, more people the opportunity to participate. We don't have any meeting authorizations at this time, and there were no items of referral or pending items to report on. Jumping to our topics for discussion. The first is our COVID-19 update, and one of the things that we're going to be doing early this week, and we're starting that process, is we want to offer clinics at each of the towns. So we're going to be working with your towns to try to set up a clinic. We want to set up something similar to like a flu clinic schedule so that we're able to announce them all at the same time. And then we'll be working with Don Lehman to help us publicize those on all of our social media outlets, in addition to our, regular media outlets. So we want to do that. In addition, we are working with our WIC program to see if there's a way to better meet that population. We continue to work with our businesses, and we're working with tourism to offer or to support or to promote vaccinations in an effort to try to keep our testing site, or not testing, our vaccination site at Exit 19 at the Sears building. We're very happy that that's there. We're very appreciative the state's allowed that to continue to be there for the time being, but we also are trying to do what we can do to drum up business to utilize that to the best of our ability in our community. And we think by trying to advertise that to our tourists, that might help, in addition to just working with our regular partners. And with that, I'm going to turn the floor back over to Ton to talk about Office of the Aging reimbursement that we have. And I just think this highlights the wonderful working relationship that we have with other departments and other agencies. We do services to support each other, whether it be public health helping with theirs or their agency helping with ours. And this is one example of one of those mutual beneficial opportunities. And I will turn the floor over to Ton.
We wanted to just mention and want to thank, as Janelle said, Dee Parks and her staff, but Dee came to us. She has a grant she gets every year for health reasons that she can help those over 60 population. And usually in the past years, it's a $5,500 grant amount or whatever she gets funding that we can bill for. Usually what we do is we go into the meal sites and places and do our blood pressure clinics. But due to COVID, as you know, we haven't been able to do that. So Dee became creative and said, wait a minute, we've spent a lot of time helping those 60 and older get vaccinated, helping them get online, helping with phone calls, and so she contacted us and asked if we could put together as much backup as we could to prove that, and we could get that $5,500 still. So I will tell you that Dan Durkee and Mike Trammell, they both worked very hard in going on the state system, getting all those that are Warren County 60 and over. They took almost a half a day trying to get all that, if not a whole day, trying to get all that document. Plus, we have where our staff took time if a senior called, and as you all know, in the beginning, it was very difficult to get online, or they didn't have a computer. So staff was helping them and guide them, and we were able to build some time for that. And also in the beginning when all this started, so this has to be from, well, we did some things last year, but it was mainly from January to March when they went into the assisted livings and they went into the high rises and they vaccinated all those people. So all the time for our clinics, for those people to go out there. And Anyway, I got up to $5,500. It actually, obviously, of course, as you probably all would be aware, that it is over that. But Dee was able to have us bill the $5,500, so we were able to get that from OFA, and we really appreciate Dee reaching out to us. We didn't even think about that, but she was creative in knowing that that's what the purpose is for health purposes. And like I said, since we weren't doing the blood pressure clinics anymore, at least not last year and into this year, we still aren't, that we were able to bill for this. So we really appreciate that and got that to her.
Oh, thank you, John, for bringing that to our attention. I'm always impressed at how well your departments work together, and that's a perfect example. All right, Janelle.
Well, that's all we have. I didn't know if there were people online that had questions or people in the committee room that had questions, but we're happy to entertain any of that.
All right, anyone with any questions on the committee or people that are in the room here with any questions? All right, if not, then we'll go to Mr. Lehman and see if he has any questions for us.
Good morning, Chairwoman Frazier. No, there is no question on YouTube at this point.
Okay, thank you very much. Tom and Janelle, thank you both very much. We'll be in touch during the month. Enjoy the rest of your week. And with that, I'll entertain a motion to adjourn. Supervisor Conover, seconded by Supervisor Hogan. All those in favor?
Aye.
Aye. Opposed? Thank you.